Diarrhea. So today I'm going to present a common medical condition which is diarrhea. Basically, we will discuss acute diarrhea today, right? So diarrhea is defined as the passage of 3 or more loose or watery stools within 24 hours, right? When it lasts for less than 14 days, it is called acute diarrhea. The most common causes are viral or bacterial infections, contaminated food or water, and food poisoning also, right? Now let's come to the chief complaint of diarrhea. So patient will come with a chief complaint of loose or watery stools, abdominal cramps or pain. He will have urgency to pass stools, nausea or vomiting in some cases, weakness or dehydration. This is the most important one. Fever in infectious diarrhea, right? And sometimes blood or mucus in the stool is also seen in diarrhea, right? This is severe case. Now let's come to the physical examination of diarrhea. So first of all, there will be signs of dehydration, that is dry mouth or xerostomia. Patient will have sunken eyes, poor skin turgor, right? Tachycardia, hypotension, this is important. And then we will check temperature, pulse, and BP. As I said, pulse will be tachycardic, BP will be hypotension, and temperature in case of infectious diarrhea, it will be rising, right? Now let's come to the management of acute diarrhea. So the first and the most important step is to assess the patient's hydration status, right? We will determine whether the patient has no dehydration, some dehydration, or severe dehydration, because the treatment depends on this assessment, right? So for patient with mild to moderate dehydration, oral rehydration solution is important. That is, ORS is usually used, right? It replaces the watery and electrolyte lost through diarrhea and should be given after each loose stool, right? Now, if the patient has severe dehydration and is unable to drink or is in shock, then we will give intravenous fluids. That is, infusion ringer lactate is the most important one, right? Now, coming towards the medication. So first of all, we will discuss about the non-inflammatory diarrhea. So we will give only tab Imodium in case of non-inflammatory diarrhea, right? Remember, this is not suggested in inflammatory diarrhea because it will worsen the case. Then, so far the inflammatory diarrhea is concerned, I will first write infusion flagyl, or I can also write infusion ceprocin, which is ciprofloxacin 200 ml IV, right? Then I will write tab flagyl 400 milligram TDS, right? Then in case of vomiting, I can also write injection onset, which is basically ondansetron.